If you search for your clinic on Google right now, the first thing most patients see is not your website. It is the map pack, 3 listings with ratings, photos, opening hours, and a phone number. That section is powered almost entirely by your Google business profile. GBP signals drive 32% of local pack rankings, more than any other single factor. Yet most clinic directors only know that their profile exists somewhere online. In this video, I want to walk you through what GBP actually is, how it works, and the 4 signals that determine whether patients find your clinic or your competitors. Google Business Profile is a free, structured listing managed inside Google Search and Maps. When a patient searches for Private GP Manchester or Skin Clinic Bristol, Google uses the information in verified GBP listings to decide which clinics appear in the map pack. That listing can show your address, opening hours, phone number, service categories, photos, reviews, and whether you are accepting new patients, all before the patient clicks through to your website. Verified profiles with complete data are 80% more likely to appear in local results. Complete listings receive 7 times more clicks than incomplete ones. Those are not marginal differences. There are 4 phases to a well-managed GBP. Most clinics complete the first one and stop. The first is claiming and verifying the profile. Since 2024, verification often requires a video walkthrough of your premises. The process has become more rigorous. Many clinics still have unclaimed listings, auto-generated by Google, where incorrect information can be suggested or flagged by third parties without you having full control. The rule is straightforward. Claim first, optimize second. An unclaimed profile is an unmanaged liability, not an asset. The second phase is building out the profile completely. Most clinics add only the basics, name, address, phone number, and opening hours, and then leave secondary categories, service listings, and practice descriptions blank. That is a direct cost in visibility. Around 75% of businesses ranking in positions 1 to 3 have complete GBP descriptions. Fewer than 40% of those in positions 11 to 20 have done the same. Google rewards completeness because it signals that the listing is active, current, and trustworthy. For a private clinic, that can be the difference between appearing in the local pack and being pushed below competitors who have simply filled in more fields. The third phase is reviews. Google looks at 3 things here: total volume, average rating, and velocity, how consistently new reviews are added over time. Clinics with 50 or more Google reviews earn 266% more leads than those with fewer than 10. The average listing in the top 3 map positions has around 250 reviews. Responding to reviews also matters, including critical ones. It shows both patients and Google that the profile is actively managed. Clinics that request reviews after appointments and respond consistently tend to see their local pack visibility strengthen within 3 to 4 months. The fourth phase is ongoing. Profiles with regular posts appear 2.8 times more often in the top 3 map positions. These posts do not need to be long: a treatment update, a team introduction, a change in opening hours. The point is that the profile signals activity. GBP Insights also shows you which searches are triggering your listing and what patients do next: calling, requesting directions, clicking through. Tracked month by month, that data tells you whether your optimization is actually working. Since late 2024, GBP data has also started feeding into Google's AI overviews for local queries, making accurate, regularly updated profiles considerably more valuable. Your primary category tells Google which searches your clinic is eligible to appear for. 86% of all GBP views come from category-based searches. A patient typing Private Dermatologist London or Dentist Open Now. If a dermatology clinic is listed only as clinic, Google may not treat it as relevant for those specialty searches at all. Google allows up to 9 secondary categories. Most UK private clinics use 1 or 2. Adding relevant options such as aesthetic medicine physician or skincare clinic can expand the number of searches your profile appears for without changing anything else on the listing. NAP stands for Name, Address, and Phone Number. Google checks whether the information in your GBP matches what appears across other platforms: Doctify, Talk Doctors, What Clinic, your own website. Even small inconsistencies weaken your position. A slightly different clinic name, an old phone number, a shortened address. For multi-location practices, this becomes more consequential. Clinics with consistent NAP across all directories see a 28% improvement in local rankings. That is why a NAP audit should be the first step before any wider GBP optimization work. It is also the most commonly skipped step. Healthcare sits in a different category to most local businesses. Private clinics fall under Google's YMYL classification, your money or your life, because medical services can directly affect a person's health and safety. That means the bar is higher. An incomplete profile may be sufficient for a local cafe to appear in search. It is much less likely to perform well for a private healthcare provider. The practical response is EEAT: experience, expertise, authoritativeness, trustworthiness. For a clinic, that means named clinicians with GMC or GDC credentials, real photography, accurate NAP, and listings on trusted platforms such as Doctify and Top Doctors. Clinics with complete, trust-optimized profiles are 2.7 times more likely to be considered reputable by prospective patients. 3 things have changed in the past 2 years that make GBP more important in 2026 than it has ever been. Google's AI overviews now appear in around 32% of local queries, and they pull information directly from GBP listings. Brands cited inside AI overviews receive 35% more clicks than those not included. Second, around 60% of Google searches end without a click to a website. A patient searching for private GP Richmond may check your rating, read reviews, look at opening hours, and call directly without visiting your site at all. Third, Google's own data shows that 87% of patients who find a healthcare provider online go on to book an appointment. Your GBP is not just a listing. For many patients, it is the first and only impression of your practice. If you are not sure where your clinic stands on any of this, your profile completeness, your category selection, your citation consistency, UpMedico offers a free initial consultation. We work exclusively with UK and Irish private clinics at the intersection of healthcare SEO, patient acquisition, and compliance. We will look at your Google business profile, your citation footprint, your review strategy, and tell you where the immediate priorities are. Visit UpMedico.com to get in touch.